Cardiovascular disease is a major problem in our society, and it's the leading cause of death in the United States.
When I got to the hospital through the front doors, all I remember is looking at the lights and they were saying that you were having a heart attack. And then after that, I just blacked out.
So Tony actually presented to the hospital on Christmas Day. He had acute chest pain while he was at home, so he came into the ER. He had an abnormal EKG, which demonstrated a heart attack. So he was taken urgently to our cardiac cath lab, and we quickly put IV lines in his wrist, and then identified that he had a severe blockage in the artery right down the front of his heart, and opened up the blockage with the balloon, and then ultimately put a stent in to restore blood flow to that artery. Despite the fact that was done in a quick manner, he did have severe damage to his heart, and his heart was only functioning at about 25 to 30%. And that's why we felt the need to protect him with a life vest, knowing that he was susceptible to abnormal heart rhythms that could kill him.
They sent me home with the Zoll life vest, which I wore for 3 days, maybe 4 days at home. And me and my brother were sitting on the couch watching the Washington game, getting ready to watch the Lions. And this was New Year's Day. And he went to the bathroom. I just slumped over on the couch and was flatlined for 47 seconds. The vest shocked me like a defibrillator, and it brought me back to life.
Essentially, the life vest saved his life during a very vulnerable period for his heart.
I would not be sitting here today if it wasn't for the Zoll vest.
So a life vest is literally what it sounds like. It's a vest. And it has the ability to monitor the electrical rhythms in the heart on a continuous basis. And if it identifies an abnormal heart rhythm that could potentially be lethal to the patient or to the one who's wearing it, that it can actually alert the patient. And if the patient doesn't respond, then it's assumed that there is an abnormal heart rhythm that's going on. And in that case, it can actually shock the patient or defibrillate the patient and potentially bring them back to life.
Did you ever go fishing?
Oh, yeah.
The life vest has been around for many years, actually, but because heart attacks are so prevalent in our society, we do use them quite often. For patients who have had heart attacks, they're a good bridge to determine whether a patient may need a long-term defibrillator, but we're not quite sure if they're going to need it at this point. In terms of the future of cardiac care, I think the concept of continuous monitoring of patients, whether it be their vital signs, blood pressure and heart rate, or whether it be their electrical rhythms. I think we're in a new era of wearable technologies. The Apple Watch is the perfect example. And being able to continuously monitor hemodynamics, pressures, rhythms, while you're not in the hospital, I think is groundbreaking and where we're going to see the future of medicine going.